In this video, we will discuss male and female reproduction. To understand the process of reproduction, we will first go over the male anatomy. The male reproductive system consists of the testes, the internal genitalia, accessory glands and ducts, and the external genitalia. The external genitalia consists of the penis and the scrotum, a sac-like structure that contains the testes. The urethra serves as a common passageway for sperm and urine, although not simultaneously. It runs through the ventral aspect of the shaft of the penis is surrounded by a spongy column of tissue known as the corpus spongiosum. The corpus spongiosum and two columns of tissue called the corpora cavernosa constitute the erectile tissue of the penis. The testes produce sperm and hormones. The testes have a tough outer fibrous capsule that encloses masses of coiled seminiferous tubules clustered into 250 to 300 compartments. Interstitial tissue with blood vessels and testosterone-producing interstitial cells of Leydig lies between the tubules. The seminiferous tubules constitute nearly 80% of the testicular mass in an adult. Each individual tubule is 0.3 to 1 meter long, and if stretched out and laid end to end, the entire mass will extend for about the length of 2.5 football fields. The seminiferous tubules leave the testes and join the epididymis, a single duct that forms a tightly coiled cord on the surface of the testicular capsule. The epididymis becomes the vas deferens, also known as the ductus deferens. This duct passes into the abdomen, where it eventually empties into the urethra, the passageway from the urinary bladder to the external environment. Seminiferous tubules. The seminiferous tubules are the site of sperm production and contain two types of cells: spermatogonia in various stages of becoming sperm, plus supportive Sertoli cells. The developing spermatocytes stack in columns from the outer edge of the tubule to the lumen. Between each column is a single Sertoli cell that extends from the outer edge of the tubule to the lumen. The function of Sertoli cells is to separate sperm development. Another name for Sertoli cells is sustentacular cells because they provide sustenance or nourishment for the developing spermatogonia. Sertoli cells manufacture and secrete proteins that range from the hormones inhibin and activin to growth factors, enzymes, and estrogen binding protein, or ABP. ABP is secreted into the seminiferous tubule lumen, where it binds to testosterone. Testosterone bound to protein is less lipophilic and cannot diffuse out of the tubule lumen. Interstitial cells, Leydig cells, located in the interstitial tissue between seminiferous tubules, secrete testosterone. They first become active in the fetus when testosterone is needed to direct development of male characteristics. After birth, the cells become inactive. Spermatogenesis requires gonadotropins and testosterone. Hormonal control of spermatogenesis follows the general pattern described previously, which is hypothalamic GnRH promotes release of LH and FSH from the anterior pituitary. FSH and LH in turn stimulate the testes. The gonadotropins were named originally for their effect on the female ovary, but the same names have been retained in the male. GnRH release is pulsatile, peaking every 1.5 hours, and LH release follows the same pattern. FSH levels are not as obviously related to GnRH secretion because FSH secretion is also influenced by inhibin and activin. FSH targets Sertoli cells. Unlike oocytes, male germ cells do not have FSH receptors. Instead, FSH stimulates Sertoli synthesis of paraffin molecules needed for spermatogonia, mitosis, and spermatogenesis. In addition, FSH stimulates production of androgen-binding protein and inhibin. The primary target of LH is the interstitial cells, which produce testosterone. In turn, testosterone feeds back to inhibit LH and GnRH release. Testosterone is essential for spermatogenesis, but its actions appear to be mediated by Sertoli cells, which have androgen receptors. Spermatocytes lack androgen receptors and cannot respond directly to testosterone. Spermatogenesis is a very difficult process to study in vivo or in vitro, and the available animal models may not accurately reflect the situation in the human testes. For these reasons, it may be some time before we can say with certainty how testosterone and FSH regulate spermatogenesis. Now we will discuss female reproduction, starting with the female anatomy. Female reproduction is an example of a physiological process that is cyclic, rather than a steady state. The cycles of gamete production in the ovary and the interactions of reproductive hormones and feedback pathways are part of one of the most complex control systems of the human body. The female external genitalia are collectively known as either the vulva or the pudendum. Starting at the periphery are the labia majora, folds of skin that arise from the same embryonic tissue as the scrotum. Within the labia majora are the labia minora, derived from embryonic tissues that in the male give rise to the shaft of the penis. The clitoris is a small bud of erectile sensory tissue at the interior end of the vulva, enclosed by the labia minora and an additional fold of tissue equivalent to the foreskin of the penis. In females, the urethra opens to the external environment between the clitoris and the vagina, the cavity that acts as a receptacle for the penis during intercourse. At birth, the external opening of the vagina is partially closed by a thin ring of tissue called the hymen or maidenhead. The hymen is external to the vagina, not within it, so the normal use of tampons during menstruation will not rupture the hymen. However, it can be touched by normal activities such as cycling and horseback riding, and therefore is not an accurate indicator of a woman's virginity. Now let's follow the path of sperm deposited in the vagina during intercourse. To continue into the female reproductive tract, sperm must pass through the narrow opening of the cervix, the neck of the uterus. Some primordial follicles develop slowly into primary follicles. The oocyte enlarges and the granulosa cells begin to divide but remain in a single layer. At puberty, chemical signals cause groups of primary follicles to leave their resting state and enter a period of active growth that may take months. As the growing follicles enlarge, a layer of cells known as the theca develops outside the basal lamina. At this point, the follicles are known as preantral or secondary follicles. Some primary follicles never complete the transition to secondary follicles and are lost through atresia. As the secondary follicles enlarge, granulosa cells begin to secrete fluid that collects in a central cavity in the follicle known as the antrum. Antral fluid contains hormones and enzymes needed for ovulation. At this point, the follicle becomes a tertiary follicle. From the pool of early tertiary follicles, only a few follicles survive to reach the final growth stages, and usually only one, called the dominant follicle, develops to the point where it releases its egg. The time required for growth from secondary follicle to the selection of a dominant tertiary follicle is estimated to be 3 months or more. Female humans produce gametes in a monthly cycle at an average of 28 days, in a normal range of 24 to 35 days. These cycles are commonly called menstrual cycles because they are marked by a 3 to 7 day period of bloody uterine discharge known as the menses, or menstruation. The menstrual cycle can be described by following changes that occur in follicles of the ovary, the ovarian cycle, or by following changes in the endometrial lining of the uterus, the uterine cycle. The ovarian cycle is divided into 3 phases. The follicular phase, the first part of the ovarian cycle, known as the follicular phase, is a period of follicular growth in the ovary. This phase is the most variable in length and lasts from 10 to 21 days. The second phase is ovulation. Once one or more follicles have ripened, the ovary releases the oocytes during ovulation. And the third phase is the luteal phase. The phase of the ovarian cycle following ovulation is known as the post-ovulatory or luteal phase. The second name comes from the transformation of a ruptured follicle into a corpus luteum, named for its yellow pigment and lipid deposits. The corpus luteum secretes hormones that continue the preparations for pregnancy. If a pregnancy does not occur, the corpus luteum ceases to function after about 2 weeks and the ovarian cycle begins again.